Hello, ladies and gentlemen. Pavel Krastev, DDS, with you here today from New Hyde Park, New York. I'd like to welcome you on behalf of Global Summits and myself. As usual, we have a very exciting show today with a new friend that I made, Dr. Albana Gjeka Sgouridis, and she's joining us from Albania. So I'm very excited, and the reason I'm very excited is because she'll be talking about using opportunities in your current situation. When you're a healthcare provider or other professional, where you can use your resources and sort of gauge and invest in the future financially via personal investments and not event planning, but estate planning, and what you can do so that you can essentially accomplish anything, even moving to a different country. So it's a very exciting topic, and the reason I find it very exciting is because as doctors, in my case, a dentist, we are limited in the amount of learning and education that we get in dental school or medical school. And this is what many colleagues complain about, that we know how to do dentistry and medicine, but we don't very often know enough about business and what opportunities one can take advantage of in order to develop a financially beneficial and healthy lifestyle, as well as also to set aside and do the proper investments for your retirements. So I'm very excited about this topic, and like I said, it's great to meet a new friend always. A quick apology, I'm a little swollen today, as you guys can see. So because finally I got some of my own medicine, I'm getting a new smile makeover done by the infamous and famous warrior in the battlefield, and gentleman with the ladies, Dr. Sharif Radwan, who's a globally renowned clinician. So that's why I excuse my appearance a bit. We had the procedure done yesterday, so I'll be a little bit off my usual. So anyhow, let me read you Dr. Sgouridis' bio. It's a long one. And then I'd like to take a moment and introduce it to the audience. Okay, let's find it here. Here we go. All right. So Dr. Gjeka Sgouridis, raised in Lushane, Albania, completed her dental surgery doctor from Tirana University School of Dentistry. Since her graduation as a DDS in July 2002, Dr. Albana Gjeka has attended and completed several specialized training courses from Western Europe. She holds certifications from Synergy in Class 4 Restoration. For 5 years, she worked diligently as a hands-on general dentist in Tirana, Albania, serving the community and helping those in need. Dr. Albana Gjeka remains passionate about learning, committed to acceptance and encouragement of diversity, and stresses state-of-the-art technology in dental care. Her standards are very high. She remains up to date on current medical dental developments and issues. As a collaborative and lead by example leader with excellent communications and interpersonal abilities to build rapport and respect with culturally diverse teams. She looks forward to serving her patients to the best of her powers, expanding her business, etc. She emphasizes patient education and encourages patients to take an active role in their medical care and treatment options. That's very important, by the way. I love that. We'll talk about that later. Her request to find solutions for many patients propelled her to apply to international postgraduate dental studies programs. She is studying to take the INBDE. After immigrating to the United States, Dr. Gjeka Sgouridis settled in Chicago with her daughter and husband. Believing firmly in the value of continuing education and pursuing graduate studies in healthcare administration is necessary for today's healthcare environment. It provides the competitive advantage needed to build a successful career and expand her business. All the while, she will be developing her knowledge and talents to advance and thrive. These learning experiences from Executive Master of Health Administration from the University of Southern California, SOL Price School of Public Policy, and experts from around the healthcare spectrum are a comprehensive learning strategy that learning strategy that combines a scientific, evidence-based design philosophy with straightforward hands-on approach, delivering the best healthcare for her community. As a detail-oriented and knowledgeable operational leader, she drives best practices and high standards for excellence to enhance productivity and ensure patient satisfaction, while consistently meeting and often exceeding business profitability and growth goals. Endorsed by several essential personalities, including Dr. Bill Williams, as her sponsor, and as a strategist for healthcare, she utilizes collaboration strategies to bring efficiencies between stakeholders while maximizing quality benchmarks to improve and thrive. As a quote, she believes in leading by example. Leader with excellent communications and interpersonal abilities, she can build rapport and respect with culturally diverse teams. So Dr. Sgouridis, welcome to the show.
Thank you, Dr. Patel. It's an honor to be here today, and I appreciate very much this opportunity, and I will take advantage to explain a few solutions to the risk management that we are currently experiencing today.
Yeah, it's like I said in the introduction, it's very exciting, your topic, because as I said, it's more often than not that as healthcare professionals, we really lack business acumen and knowledge. And without it, it takes us sometimes a long time into our practice to understand that we can do so many things in such a better way if we take advantage of managing the business end of things. So I'm very excited. Welcome on behalf of all of us. I'm sure our audience is as excited as I am. And please go ahead. Go ahead with your presentation.
Thank you, Dr. Patel. I look forward to it and go from there.
Sure.
Today, I'm going to talk about leadership and strategic management of healthcare organizations, and specifically apply this strategy in leadership, business planning, and insurance planning. To do this, I currently affiliated with the Guardian Life Insurance, particularly with the Peach Financial Group. I am a broker and I own the license in health and life in the state of Illinois. So I am legal to do that, but also this is the best thing to do for my colleagues and friends to help them with financial planning, business planning, and any planning they need to in order to accomplish their goals. Although life throws financial challenges at us without warning, forcing us to switch priorities, having basic knowledge combined with strategic plan, we'll find a solution even when it is devastating financial situation. As doctors, we understand that practicing preventive or proactive medicine is far better than reactive medicine. Therefore, it is vital to have proper financial planning and take advantage. This presentation will give you the information and tools for effectively leading your organization and reviewing the insurance planning, as well as advise you in choosing the best insurance company. As a financial professional, I will help you avoid common pitfalls and provide the best guidance for your needs, take advantage of opportunities early in life, and delivering personal, objective financial planning and investment management services that put our clients and their best interests first, always not simply because it is legal requirement, but because it is the right thing to do. So in this presentation, your focus is on leadership and finding financial solutions. So what we have to do? Let's start with planning for the road ahead, like focus on the specific needs and goals that we have on your investment, retirement, education, taxes, insurance, and estate planning. And the path to the financial security can be challenging because healthcare value is quality of care divided by cost of care, and the best healthcare value is when we have the lower cost. Now, our mission, vision, and goals and objectives include, let's start, our mission is to improve the quality of life for people and their communities. Our vision is company culture that drives engagement, enjoyment, and profits, setting realistic for accomplishing your future financial goals. And the goal is to help our clients do their best and be financially secure. So the objective, mission, vision, and goals give the objective, and my approach is to educate medical and business professionals about proven strategies to protect wealth and income, To deliver on the promise of providing education regarding financial security and transferring risk, describe the demographic, social, medical, and other changes that given rise to the challenges presented by increasing need for long-term care and services. Give clients a picture of the various types of levels of care services, as well as the probability and circumstances under which they might need these services. Educate clients about the cost involved in obtaining long-term goals and how the costs are usually paid. So all in all, to advance the financial planning discipline. Now, moving beyond the population health 2020, 21, 22, and facing the biggest challenge in the past 24 months, COVID-19, healthcare organizations experienced a revenue loss of nearly 40%. Hospitals lost between 53 billion and 122 billion this year. The world is facing emotional crisis.
Dr. Albana, I'm sorry, I'm going to interrupt you for a moment. I apologize, but can you share your screen because we can see you, but we can't see your presentation.
Okay. I don't know how to do that, doctor. Just 1 second, okay? Just
sure.
I thought Ansh will share the screen with me.
No, you have to share it yourself. And then perhaps we can just start from the beginning of the presentation so that the audience is not confused.
Okay, so
if you don't mind. Let me see. I'll see what else. So, okay. Do you realize how to share it?
I'm going from the very beginning and already is shared on the Zoom. So I don't know on your end, but on my Zoom is already shared. I already shared with in the beginning, so I don't know what else can I do right now on my end.
Let me see. Mr. Ansu, can you hear us in the background?
Yeah. Do you see a share screen icon on at your end, Dr. Albana?
I did already with you in the beginning, and I'm already on presentation. So.
No. Do you see a share screen icon? If you click on it, it will show you all. Yeah.
How about now?
Yeah. That's good. That's good.
There we go.
Okay. Are we okay?
Yeah, if you don't mind, if you could just re-roll to the beginning so the audience doesn't get confused, and
okay.
Let's start from the beginning. Thank you so much. I
apologize. You're very welcome.
Trouble.
So from the beginning, my current position, I am a broker affiliated with Guardian Insurance Company, and particularly the FIT Financial Group. And today I'm going to speak about leadership and strategic management of healthcare organizations. You don't need to have cash to start a business, but you have to have a plan, and you have to have the leadership skills and the proper financial planning to make it happen. That's all about what we have to talk today, and I'm going through the whole presentation. Now, let's start what is going on today and what are some key areas that we must focus and why is this important. Although life throws financial challenges at us without warning, focusing us to switch priorities, having basic knowledge combined with a strategic plan will find a solution even when it is a devastating financial situation. As doctors, we understand that practicing preventive or proactive medicine is far better than reactive medicine. Therefore, it is vital to have proper financial planning and take advantage. This presentation will give you the information and tools for effectively leading your organization and reviewing the insurance planning, as well as advise you in choosing the best insurance company. As financial professional, I will help you avoid common pitfalls and provide the best guidance for your needs. Take advantage of the opportunities in life and delivering personal objective financial planning and investment management services that put our clients and their best interests first, always, not simply because it is legal requirement, but because it is the right thing to do. In this presentation, your focus will be on leadership and finding financial solutions, planning for the road ahead, focus on specific needs and goals, shape decision on your investment, retirement, education, taxes, insurance, and estate planning. And the path to financial security can be challenging because healthcare value is quality of care divided by cost of care. So we have the best healthcare when we have a lower cost. Now, our mission, vision, goals and objectives include: our mission is to improve the quality of life for people and their communities. As doctors, we're known as best leaders, and we're working using our mission to accomplish our goals with a vision such as leading and creating a company culture that drives engagement, enjoyment, and profits, setting realistic expectations for accomplishing your future financial goals. And goals are to help our client look and feel their best and be financially secure. My approach is today and today and always, my approach is to educate medical and business professionals about proven strategies to protect wealth and income, to deliver on promise of providing education regarding financial security and transparent risk, describe the demographic, social, medical, and other changes that have given rise to the challenges presented by the increasing need for long care or long-term care and services, and give clients a picture of the various types of levels of care services, as well as the probability and circumstances under which they might need these services. Educate clients about the costs involved in obtaining long-term goals and how the costs are usually paid, and all in all, to advance the financial planning discipline. So quality and client safety is always first, and why investment in insurance planning? Moving beyond the population health of 2020-2022 and facing the biggest challenges in the past 24 months, COVID-19, healthcare organizations experienced a revenue loss of nearly 40%. Hospital loss between 53 billion and 122 billion this year. The world is facing an emotional crisis. This advocates for value-based care, consistent and culturally appropriate messaging to empower clients, and investment in financial planning highlights the importance of appropriate planning and advocacy for long-term care. Health plans are looking to collaborate with provider organizations to ensure a seamless cash flow, but there are challenges. Also, policymakers should build on lessons learned from existing programs and develop innovative solutions. Now, in order to run an organization, we must have a strategic planning, and strategic thinking is an important part of it. Great organizations rarely have miracle moments of change. Instead, they emphasize committed, controlled, and practical leadership. Many times, the most important decision affecting a hospital future is the choice of director, of CEOs. Credit analysts needed to know how the next CEO will be chosen and that the board member is qualified to effectively engage in governing. Now, there are three major areas in the organization and personal performance that are deficient and are costly financially and morally. And these are: first is leadership, second is teamwork, and third is communication. The three keys to be trusted and effective leader are the cohesive team builder, the effective communicator, and the strategic thinker or emotional intelligence feeler. So to achieve a high level of competence in these three dynamics requires a variety of soft skills, such as strategic thinking, strategic planning, emotional intelligence, creative thinking, and change management. Now, why we need leadership, and what is the role of strategic planning, and what is the cycle, and what we have to do, and how can we do that? Well, strategic planning cycle includes our goals, where do we want to go, and what are our desired outcomes, and how do we go there, what strategies we need to go there, and how do we measure success. We have to have charts and study with the statistics and see how did we do, and we see the results. And then when we see the results, we just think about it, and we have to change those results, and we want to improve, and we set up another set of goals, like 3 months from today, 9 months from today, 3 years from today, 5 years from today, and it goes in a cycle. Now, leadership is vital because to succeed, executives must have a robust shared data foundation. Leaders must explore how the right team, share data, and common incentives finally make it happen, navigating activities at the team management, at the operating, at coaching, and training. And all in all, this will help us to improve practice level and promote evidence-based medicine and patient management and engagement. Now there are two parts of a strategic planning cycle. We have strategy formulation and strategy implementation. The strategy formulation includes planning and organizing, and strategy implementation includes leading and controlling. The strategy formulation under planning include vision, mission, goals, and objectives or our organization. Organizing include organization design, culture, and social network that we're using. In order to implement the strategy, we have to have the leading and controlling. How do we lead the dental organization is by using leadership, decision-making, communication that we have to have in our environment, groups and teams that we're using, and what motivation cycle we're having or style we're having to motivate this team to keep working. And how do we control? We control by using systems and processes. We control by using strategic human resources and go from there. Now, why we need leadership performance and why we need business performance? We need leadership performance because we need to measure, understand, and improve, getting rid of bad habits and adding new habits, building emotional intelligence competencies, being resilient, exercising good judgment, and building a high-performing team. Why we need business performance? We need business performance because having a strategic planning cycle, building performance culture, achieving employee engagement, achieving customer engagement, delivering service and operational excellence, and executing strategy. This is the final step. We have to do it. I'm going to focus on three important areas on why we have to have these skills and strategic planning, such as emotional competencies, exercising good judgment, and why resilience. Everyone has a natural level of emotional intelligence. And most importantly, emotional competencies can be learned if someone is motivated to do better. These competencies relate to people, social skills, and managing emotions maturely, and getting feelings to go ahead and get better. And the goal is to demonstrate intra and interpersonal skills, so the one that is engaged and engaging other people and team members in the organization. Exercising good judgment is vital because consistently making the right calls for big decisions is crucial. Leaders, directors, CEOs, and managers must focus on getting the critical business decision right, especially concerning strategy, staffing, and operation. So risk management is vital, and people's judgment can be some at the hardest. It's very hard thing to do. So good judgment is not an inherent trait for most people, but rather a skill that can be developed. And half of all decisions end in failures and can damage one's heart and one's brain. So insurance and financial planning are essential for risk management solution, helping leaders get rid of bad habits and add new traditions. Patterns can be personal, like you can exercise and change yourself, or can be professional, such as setting realistic goals. And they can be learned and become the second nature. And we know that brain is a slow learner, and it takes a lot of practice and persistence. So we have to be persistent and continuous, so we can exercise in good judgment and help our organization not to go to a failure, but to go to a winner. And why we need resilience? Resilience is a very, very important, because being resilient and warm bring people connected, build trust, and enables one to influence others. And using positive energy and thoughts to cope with turbulence and distribution is critical to sustainable performance practice in recovery. And the goal is to avoid stress and burnout, which impact 70% of managers in their career. And we need to recover. Energy is expected and must be recovered. And human beings are not machines. That's why we need resilience. So the results of strategic planning are that strategic planning is a periodic process of developing a set of steps for an organization to accomplish its mission and vision using strategic thinking. Strategic planning provides a step-by-step process for creating a strategy, involves strategic thinking sessions, requires data, information, and incorporates consensus and judgment, facilitates decision-making, reaches consensus on what is required to feed the organization with an external environment, and results in document strategic plan. All in all, a strategic planning defines where the organization is going or not going and provides focus. So I did a SWOT analysis because we want to know what are external factors and what are internal factors and what can we do to improve to accomplish our goals. So the SWOT analysis means strength, weakness, opportunities, and threats. Identify and assess the business unit strengths and opportunities. Get the problematic issue on the table for discussion. Identify gaps in current business practices. Identify opportunities for leadership development. Sign off on action plan to take the business to the next level. And why we need leadership all in all? We need leadership because leadership drives engagement and engagement drives performance. On the other hand, behavioral and business competencies are assessed by coworkers. And financial planning helps teams and clients understand their strengths, weaknesses, and provides a roadmap to improve performance and culture. Now, if you can see in the picture here, and you can see external factors are opportunities and threats, and external factors include technology, competition, economic, political, legal, or social trends. And internal factors are strength and weakness, such as financial, technical, competition position, human resources, and product line. So what we're trying to do in this presentation and with the strategic planning, thinking, and improving our financial part, the financial is an internal factor. It can be a weakness, and by building that, the weakness can turn to strength, and we lead with our strength and become great leaders. So it's so important to focus on this financial that is an internal factor and make that weakness to become a strength, especially for the foreign graduated dentists that come in the United States is a challenge financially, is a weakness, but we can turn that weakness to become a strength. And then I'm explaining that with my example as well in this presentation. Now, why dental offices and small businesses, why financial planning is important for the population health? Well, small businesses are the backbone of our economy. We are helping business owners thrive through this economic winter. Financial planning helps you learn how to save thousands of dollars per year in taxes, fast track your knowledge of numbers and cash flow, find hidden profit and cash in your business, and get your questions answered specific to your industry and business needs. So financial planning will benefit medical professionals from the beginning of their career while transitioning in residency and work. And while most dentists can earn a fortune, without appropriate planning and management, the money that passes through their hands will fall through their fingers. And planning for financial protection can stop that from happening. So why budgeting is important? Budgeting means that it looks at your financial picture and helps you prioritize how to spend and save on a regular basis. Financial planning, on the other hand, is a broader look at your entire picture over time. It can show you how and where you will save money to reach your goals, and typically includes aspects to help you on track if something unexpected should happen. Now, why budgeting is important? It's important because it will help you visualize how to spend money today and where you can make changes based on your plans. Cash is a liquid money. Amount of money needed to oil the financial wheels means that you need to have cash so that 60% of budget should go toward fixed expenses, such as this include costs like mortgage, rent, car payments, daycare, groceries, or basically like, let's say, expenses that are essential to your daily life. And out of that budget, 20% should go toward financial goals. Like financial planners often use a rule called the 4% rule. So we need to know that you have a budget, and then we can work and help you to accomplish your future financial goals based on this 4% rule. And a financial professional helps you make sure what is needed today and how to achieve that, and what do you have to do in the future. So ensure you will be able to afford your future goals by focusing on the budgeting, and then you can go and do financial planning. So building financial securities doesn't mean that your challenges are behind you. New challenges may come in your way, like, for example, have I saved enough money for my future? How much can I afford to spend each month so I don't run out of money? What will I do with all my newfound time? What if I want to keep working? What investments are right for me in retirement, and when should I make the change? And what do I need to do to protect my spouse and children if something happened to me? So other household priorities and goals are cover our children college, education, retirement, protect family against the death of breadwinner. All this help you make decisions for your family, manage and grow private practice, steps needed to form an efficient investment portfolio, investment and wealth management. And all in all, a financial plan is a written document which lists your household financial priorities or goals and lays out steps you must take to achieve them. So what to accept in a financial plan? In a financial plan, you have a customized and biased proposal based on your unique needs, resources, and goals. Then you have a practical strategies to navigate the complexities of your financial life, building on strength and addressing weaknesses. Flexibility to handle the good, bad, and unexpected in personal and professional lives, and help monitoring and revising to meet your goals, as well as your lifestyle. So this is what you expect in a financial plan. Now, what is my vital role and approach? My vital role is significant because usually financial professionals play a vital role in their clients' lives. As a financial professional, I consider how important it is to consult clients about their long-term care goals and needs. As a doctor and financial professional, I must be able to assess whether a client health insurance needs are adequately addressed by his current program. If additional coverage is needed, I should be able to compare products honestly and intelligently to show how one policy differs from another in coverage, benefits, and overall treatment of claims. And if additional coverage is needed, I should be able to compare products honestly and intelligently to show how one policy is better than the other and give them a recommendation. So patients and coworkers look to find a dentist to trust. And my approach is apply all the objectivity, integrality, and diligence you expect from a financial planner, integrate tax consideration within the entire financial plan, consider how decision affects other areas of the plan, and identify and address areas of the risk in the plan. So what are some key takeaway points from all of this financial planning and what we have to do? Being accountable, leading change successfully, and dealing with employees' emotions on this journey is critical for reinvesting the business and coping with the external environment. Execution is necessary from a competitive advantage when carried out better than competition. And people and medical professionals are living longer and require financial planning. Changes in society over the past 3 decades have significantly reduced the availability of family members who traditionally provided long-term care services for aging parents and grandparents. Then financial professionals must be able to assess whether a client insurance needs are addressed adequately by his current program, and the moment of uncertainty should inspire investors to focus on decisions and strategies that have historically led to consistent outcomes. One of them is focusing on insurance, which is an old business and industry and a very successful industry. So take advantage of this opportunity because it has great results and has proven results more than 160 years and helped a lot of families. So what are your needs in general? Your needs are first and foremost a clear understanding of where you are and where you want to be, income tax planning and preparation, estate planning, retirement planning, investment planning, education planning, strategic business planning and consulting, and risk management planning. So income tax planning and preparation include impact on tax law changes, short and long-term planning, reducing future liability, dealing with the IRS, and estate planning is like review, keep, preserve, and honor. So we review wills, trust, and retirement plans. We keep all documents up to date. We preserve assets for the next generation and reduce tax liability, and we honor your wishes, what you want to do for your future, and who's going to be your legacy or your beneficiaries. And today, Americans spending their retirement style has changed. The definition of retirement has changed considerably in recent years. And now more than ever, seniors are maintaining an active lifestyle that includes travel, exercise, new experiences, or some of them want to keep their mind busy, like continue learning. So it's important to understand what are your goals, what does your retirement look like, how much is needed to get there, and primary resources of retirement income and distribution models and tax-efficient financial choices to be considered. So we give those options to consider. Now we want to invest. Investment planning includes risk tolerance, asset allocation and cash flow, investment options, strategies for financial setbacks or windfalls. Moreover, as we go through education plan, and those are short-term goals and long-term goals are two kind of different goals. We have short-term goals are completing your education, paying off for your college, and buying a house. And long-term goals include retirement, investment, and etc. So education planning is like a short-term goal, and we have to look at what strategies for consideration are there. Tax credit and deductions, involving your children, updating your plan to reflect life event changes. And moreover, business planning. Like after we have the education, we have a business planning, like setting up a realistic business plan, organizing structure, financing, and look at employee benefits, executive competition and compensation, retirement plans, insurance and other considerations, and integration with personal financial goals and plan. Then we have to look at the risk management planning, like protection of assets, understanding liability in business venture, effect on loss on income or assets, world event, both naturally and man-made. What are some of the risks that you think is going to happen on both ways? And after we have all this set up, we look at who is going to be your financial planner, who is going to be your financial advisor or financial professional to help you. And we have to find the one that you have a relationship and trust on that person. You have to find, you have adherence at professional code of ethics. So that person who is helping you is very ethical person. You have to look at the financial advisor at education, qualification, and credentials. You have to see complex tax knowledge. Does he have or she has complex tax knowledge? And availability, is she flexible? Is she there for you? Is he there for you? So whatever, you know, you have to look at those criteria to find the best financial planner for you. Now, what are some consistent investment strategies and go from there? So the moment of uncertainty should inspire investors to focus on decisions and strategies that have historically led to consistent outcomes, such as take advantage of opportunities that the insurance industry offers, as I mentioned before, to help you focus on your big picture and the fundamentals instead of the fearsome headlines. I'm offering our critical solution to consider in your future. So many investors wonder if the selling pressure is likely to continue or when it might be a good time to get out of the market, like if you want to buy or sell your practice. So my advice is to push back against uncertainties of politics and check the emotions at the door, because the economy's engine is moving forward by small businesses and corporations, not by politics. And it is essential to remain focused and not to rely on the government. Feeling wrong about uncertainties may lead to feeling bearish, means that a bearish investor believes prices will go down and eradicate a significant amount of wealth, leading to selling stocks for the wrong reason. I think that's a big mistake. And the stock market responds for far more to long-term earnings and economic growth trends. Therefore, remain focused on the long-term outlook, and several factors are producing optimism right now. And I'm referring, for example, to the value of owning a diversified portfolio of stocks over the long periods. So sales often provide strategic opportunities to rebalance the portfolios. If your asset allocation is adjusting based on your change to your long-term goals or needs, now may be the time to think about it. And then my advice is to stay patient and do nothing, because it is essential to remain focused on your investment decision-making process. So it's hard to tell you how long the downside volatility will last, whether it will be trigger a full-on correction of 10%, 20%, or what market areas will outperform on the downside. So claiming is just a guesswork, is not a real work. So sell-offs means that a sale of assets typically at a low price carried out to dispose of them rather than average trade. So sellers often provide a strategic opportunities to rebalance portfolios. And if your assets allocation needs adjusting based on a change to your long-term needs and goals, now may be an excellent time to consider it. You have to consider it. And otherwise, my advice is to stay focused, patient, and do nothing. So you don't have to sell your practice, you don't have to sell your real estate because you think that there is a turbulence. You just have to be patient, you have to be careful, and do nothing if you think that you're losing money. Now, the big picture vision and financial planning helps you make better career and financial decisions, such as should you stay with your company or you start your own? Does it make sense to pursue a new degree as professional path late in your career? Should you pay for your child college or fund it in another way? Can you afford to buy a vacation home at the beach, or overall enjoy a happy marriage? So vision is crucial to your success. It starts with a comprehensive wealth management system that incorporates risk management, wealth accumulation, wealth preservation, distribution, and all in all, if you want to do philanthropy in the end, is very valuable for the community you serve. Now, we want to make our goals SMART goals. SMART means specific, measurable, attainable, realistic, and timely. What does it mean? It means that a financial plan can help you work on reaching multiple goals, such as paying off a wedding, buying a home, growing your family, paying off debt, sending your kids to college, starting a business, and living your retirement dreams. So what does it mean, SMART? SMART stands for specific, that like what specifically do you want to do? M means for measurable, how will you know when you're reaching it? Attainable means that is it in your power to accomplish it or not? And realistic is that can you realistically achieve that goal or just you cannot? And timely, then when exactly do you want to accomplish it? So the role of leadership today is very important because the main role is to improve the general population health and well-being. We're known as the best best leaders in the community, and our role is to improving the general population health and well-being. And many financial transactions needed to support operation of a business getting the business risk. This required effort to provide health insurance coverage, insurance planning, promote healthy behaviors, and prevent illness. Therefore, an important insurance planning activity is to control the financial risk. I don't know how familiar are you with finance and insurance planning, but there are 4 basic finance activities, such as 4 C's are cost, cash, capital, and control. And cost is resource use associated with providing a specific service. Cash means for dental business and startups can be profitable but face a crisis due to a shortage of cash. And cash is a fountain lubricant that makes the wheels run smoothly. Capital, on the other hand, is the fund raised by business that will be invested in assets such as building, equipment, lands, dental offices that provide goods that support the organization mission. Control, we need adequate control mechanism to ensure the capital. Here we need, let's say we're needing a broker to help insure properly by providing a perfect customized plan for you. And insurance means transferring an uncertainty about whether a loss will occur. So you transfer that risk from you to the insurance company, and the insurance company will be ready to pay and cover you back. So putting all this plan together must have a transfer risk insurance, and completing all puzzle units will form the entire picture. That's why we need to have all these plans together. So maybe your job can be a safe job, but hobbies and other activities such as smoking, heavy drinking, and other behaviors, bad driving record can affect your lifestyle and can put you to a risk. Now, high-risk jobs does not include dentistry, but healthcare settings, including preparation for unknown exposures and pandemic flu, is a high-risk job. And hobbies such, you might have a safe job, but you might still be considering at high risk if your hobbies are scuba diving or racing cars or skydiving. Those are called high risk and high risk population of people. Smoking, in case you smoke, you risk yourself with several health related issues and you're considered in a high risk. Heavy drinking, if you consume alcohol regularly, you risk yourself with alcohol related health issues. And also bad driver record may lead to higher premium or in your insurance. And accidents, traffic violation, where you were to at the fault will also cost you. So these are considered high risk jobs and high risk population. Now we also need innovation. And what plans have you made to protect your financial future? What are some of the threats that you're having, but also what plans have you made in order to protect your financial future if significant social changes might happen, like let's say relocation, you're going to another state, women in workforce, both spouse and wife are working, divorce or long-term care. And families today tend to be more geographically spread. Women tend to work more often and divorce is more prevalent. And all these factors make it difficult to provide care for their elderly members at home. Now, I'm just going to go a little bit and explain that why it's so important for the dentist and why they play a major role in population health is that because we're known as a leader and we help communities where we serve. And public health aligns around quadruple aims such as improving population health, per capita cost, care experience, and joy in work. Now, the role of behavior in morbidity and mortality is vital because health is caused by 5 domain factors, such as genetics, social circumstances, environmental exposures, behavioral patterns, and healthcare. So why insurance planning is important? Because it is important there are only 4 behaviors that count for the most premature death. And the 4 behaviors that count for the premature death are smoking, diet and nutrition, alcohol consumption, and physical activity. Also causes other premature death is caused by infections and mental disorder. But we're talking in general, there are 4 biggest factors that affect the premature death. And when people go and do an insurance planning, not just only they learn a new thing about how important it is, but they also insurance motivate people to change that behavior and improve the behavior to a better behavior so they don't have a premature death and improve the population health. That's why everything is so related in healthcare and population health and insurance and strategic planning, everything is so related. So I just want to focus a little bit on those 4 behaviors that at physical activity, because dental profession is considered has a sedentary behavior. We're sitting in the office for long hours, we're working for long hours, and it's a sedentary behaviors. Residents work very hard, 60 to 80 hours a week, and they also have to study many hours. It's called the sedentary behaviors. According to a study, only 26% of men and 19% of women and 20% of adolescents report sufficient activity to meet relevant aerobic and muscular strengthening guidelines. Nutrition studies indicate that children and adults spend approximately 7.7 hours per day sitting. From these people on the study, only 55% of them monitored walking time. So potential population health impact of sedentary behavior is significant. Means that a lot of sickness come because being sitting. And insurance motivates people to exercise, improve behavior, and have positive impact. Why we need education planning and residency and financial planning? We need education planning because medical school is becoming more expensive. The after inflation income of physician is decreasing. Increasing bureaucracy and liability are making the practice of medicine more onerous, and physicians can still have a great life by optimizing their finance and investing practices. So residency and financial planning recommendation for me is that your focus when you are in dental school or residency is to become a great doctor. You don't have to worry about your finances, but you have to be careful, and recommendation is to be careful with expenses. Buy a high quality individual disability insurance policy. If someone else depends on you, buy a large life insurance policy. Start saving as a resident, preferably in Roth IRAs and 401ks, and invest in a whole life policy as much as you can, but you don't have to worry about it while you are in school. Your main concern is to become a great doctor. That's very important. Because money problems are a major source of stress, and according to study of American Psychiatric Association, 70% of adults worry about money, and that can take a toll on your physical health. Financial stress is linked to physical conditions such as diabetes, heart disease, migraine, headache, poor sleep, anxiety, depression, and all these conditions robbing your peace of mind to enjoy your life today. So you're not focusing today what you have to accomplish. So it's so important to focus at the moment. And taking steps today to get your retirement planning on track, for example, is an important steps in your overall financial wellness, which is vital for your financial and emotional health. And stress affects our mind, behavior, emotions, body. So I'm not going to go in detail, but let's say we have impaired judgment, we have accident prone because of the behavior, we have body problems, frequent infection, headaches, or fatigue, and emotions, loss of confidence, irritability, which is not helpful in dental profession. And also for the residents, this stress that is caused by money concern and problems, approximately, let's say 10% of medical school graduates entering anesthesiology residency program are already exhibiting symptoms of depression, and 30% express burnout symptoms. Burnout causes are multifactorial, with residents and burnout linked to poor resident well-being, and can also result in poor patient safety outcomes. So that's why it's so important, because stress could kill you in dentistry. And the statistic also shows that healthcare workers, including dentists, rank at number 11 on the CDC's list at the top 30 occupations likely to commit suicide. So the risk factors for occupation suicide include, but are not limited to, job-related isolation and demands, stressful work environment, work-home imbalance, financial pressure. So all in all, stress in dentistry could kill you. And we have to be careful with that. And that's why we're just trying to take advantage of opportunities to get off, and many individuals and organizational approaches to decreasing stress and avoiding negative outcomes. Individuals can control their diet, exercise, and sleep routines, build a social support network, and practice their better time management. Organization can help make expectations clear, give employees autonomy, create fair work environment, consider telecommunicating, give employee sabbatical, and utilize employee assistance program, and in the meantime help us to get out of this situation. And we need an insurance, because when we have all this financial stress, money is a major factor of stress, and other threats, external, we ask our clients that, what do you consider a threat, and what will be the biggest threat on this? For example, because of stress you have, or whatever happened, you have permanent loss of income, you have hospitalization, home, or let's say loss of home, or lawsuit. So what you have in place when you have all these threats? So you have an insurance coverage in place. And the steps to go through insurance planning are, I'm going to go briefly evaluate your needs for and situation, determine your need for insurance, determine how much income protection you need and what you already have, discover the type of insurance policy component that are the best for you, identify the factors that can impact coverage and rates, you evaluate your financial professionals and companies and purchase a policy, choose your agent, choose your financial professional and based on your financial planning needs, select an insurance company, select the policy and complete the application process, understand, maintain, and monitor your policy and make a claim. assess, monitor, and update your policy, file a claim, and find solution to your needs and to your business needs. So this is important. Now, there is different states and countries have different culture on insurance planning. Let's say in Canada, people plan better for their premature death than disability, but the chances are that the chance of illness or injury causing total or partial disability are at least 3 to 5 times greater than the chance of premature death. And when the death does occur, it does not occur very young, but it usually occurs after the age of retirement or when people get 90 or 100 years old. So disability, on the other hand, occurs more often during the income years. And 1 in 4 people could be in danger, and 95% of disabling accidents and illness are not work-related. So worker compensation doesn't cover them. So just the culture, because life insurance means that you have to insure if somebody died too young or too short, but this is not the concept in many countries. Many cultures have different concepts. It's recommendation. What we do is to have all the insurance placed based on your budget and financial planning. If you can meet those 20% of your budget to go towards your planning is so important. If you are the breadwinner of your house, it's important to have insurance in place because it will help you during the way. It will help you accumulate more income for your retirement. But what people need today is not, like the needs for disability insurance are higher when you're graduating a dental school or medical school rather than having a life insurance and etc. And the facts are that 1 in 4 people in dentistry get disabled, and 5 top causes of long-term disability claim are musculoskeletal bones. Like 90% are illness and 10% are injuries. From 90% illness, the highest percentage is musculoskeletal connective tissue, 28%, cancer, 14%, injuries and the poisoning, 10%, cardiovascular, 6%, mental psychiatric disorder, 9%, and nervous system related disorder, 7%. So based on all these facts and all these threats that we can have on the business, and based on what are the illness on the elderly, like Alzheimer's disease, arteriosclerosis, all these sickness that our parents, grandparents, or ourselves will have in the future when we get older, we have to look at and talk to our clients about their long-term care needs, and it's time for an action, it's time for a plan, and what we have to do, to maximize our chances and feel less overwhelmed for our financial future and have a peace of mind. So based on this, and the statistics and data shows that people need more disability insurance than need, life insurance, but in Canada, they plan that better because it's an opportunity to accumulate more cash during the living life. However, disability insurance and challenges that make life interesting and overcoming them is what makes life meaningful, means that there are a lot of services and products that insurance companies offer to help you in each situation that you consider as a threat. And again, insurance means transferring a risk of uncertainty. We don't know what's going to happen, but there are insurances there that can help transfer that risk and take care of you if something happened to you, and you can provide for your family, or you can be helpful for your business, whatever is your thing, that whatever you're doing right now. So disability insurance are 2 types of disability: short-term disability and long-term disability. I'm not going to go in detail about the products and services. I just want to give an idea that what we offer and how do we offer. There are a lot of benefits that medical students can take advantage of, and I will go through the recommendation and why is it important for medical professionals. So if we go to a 2-minute coverage checkup of what does the disability insurance you have through your employers, and what do you have through, like, does the disability insurance you have through your employers truly cover you when you do a checkup? And it looked like the group long-term disability insurance may not be enough through your employer. So that's why you have to own a better disability insurance. And financial professionals help you stay on track of your goals and make the best of your life. How? Because we know that life insurance companies focus on legacy planning and replacing human capital values. Health insurers cover medical costs. Property, casualty, accident insurance is aimed to replacing the value of homes, cars, and valuables. And insurance companies can be structured either as a traditional stock company with outside investors or mutual companies where policyholders are the owners. So leaders and insurance professionals have strong impact on people's lives and how world develop. A better world is where people are happier. And I just want to mention that why we need life insurance. We need life insurance because if others depend on your income, life insurance protect your family if something should happen to you. By getting a life insurance, you transfer the risk, as I mentioned before, and permanent life insurance accumulate cash value, which can help protect your family while also allowing you to grow funds that you can use for big goals while you are alive. Disability insurance is that if an illness or injury prevents you from working for a long period of time, disability insurance can help to replace some of your lost income. And retirement planning is important because it can help you avoid running out of money in retirement. Your retirement planning can help you calculate the rate of return you need on your investment. Having a plan and saving money to enjoy your retirement will allow you to find solutions on your unique needs. Now, what are some financial tips for medical students and residents? Well, student loans are not free money, and you have to live life like a student. I mean, consider your student loan burden regarding your specialty choice, and get a credit card near the end of medical school, get disability insurance, and start educating yourself in finances early. Dr. Atul Gawande said that no one teaches you how to think about money in medical school or residency. Yet, from the moment you start practicing, you must think about it. And as physicians, your most important asset is your ability to earn an income. And if you could no longer work, a disability policy would replace that income so you could continue to sustain yourself financially. You have spent thousands of hours and dollars to achieve the goal of becoming a doctor, and the sickness or an injury could keep you from being able to work, which could be devastating both financially and psychologically. So therefore, it is important to protect your income and future ability to earn an income with a disability insurance policy, for example. We help medical professionals with insurance planning. So first and foremost, make sure they have health insurance. Second, make sure they have disability insurance. Third, they have life insurance, and then start working on retirement planning and investment and wealth accumulation. Now, some people, they think that disability insurance is more likely to be used more than life insurance. However, have you avoid buying a disability insurance, and why? Why you have avoid to buy a disability insurance? And what definition of disability is important for doctors and physicians? It is essential for an individual disability insurance policy to cover you if you cannot work in your medical specialty, even if you are not performing procedures. And with the true own occupation rider, you may earn an unlimited amount while on claim, and if you cannot work in your medical specialty. Having an occupation-specific rider protects you as it gives you the control if you wish to work in another medical specialty or field of work. For example, if you are a urologist and you cannot do surgeries, but you can work still as a doctor by doing consultations and giving options to treatment. And the same can apply to ER doctors, anesthesiology, surgeons, radiologists, neurology, psychiatry, family medicine, dentists, pediatrics, and so on. And if something happened to you and prevent you from working and earning an income, then becoming so disabled, you still can have opportunity. You can still have an opportunity to get help from the insurance company basis, and we go in detail and explain more, if you can make an appointment, but this give you a lot of, if the occupation rider give you opportunity if you could do while not having the skills to do your medical specialty job, so there are some riders that are very specific very specific from some organizations, from some insurance companies that will help you if something happened to you and prevent you from working. How important are own occupation rider for non-procedural fields, and what is the role of transitional own occupation rider? Is that it is important for an individual disability insurance policy to cover you if you cannot work in your medical specialty, even you are not performing procedures, and without having an occupation specific definition in your policy, you open yourself up for the risk of insurance company deciding whether they think you could work in another capacity or are gainfully employed. So having an occupation specific rider protects you as it gives you the control, and if you wish to work in another medical specialty or field of work. So that's why it's so important. And that's why it's important to choose those insurance companies that give these specific riders for disability insurance, such as Guardian, Emeritus, Mutual, etc. So this is important. And medical students buying disability insurance, there are advantages to buy this insurance. And buying a policy the month before graduating from residency versus the month after, there is no advantages or disadvantages on this besides the convenience, except the convenience, because residents and fellows tend to get very busy with packing, moving cross country, board exams, a vacation before starting a new job and setting into attending position. So that amount of transition make it hard for them to spend the time and focus on evaluating and applying an insurance. And it may be worth evaluating and applying the month before graduating, as underwriting a policy takes 6 to 8 weeks on average. But there are challenges also when you are a resident, because one of the biggest obstacles in getting disability insurance is qualifying for it medically. That's a big thing for residents and medical professionals. On average, 4 out of 10 applicants either get modified approvals or declined altogether due to pre-existing history. And the younger and healthier you are, the more likely you are to get a clean approval for disability insurance. Another factor to consider is the hectic lifestyle of residents. They work 60 to 80 hours per week. They don't sleep enough, don't eat properly, do not exercise, which can affect their health and insurability from disability insurance perspectives. So if as a medical student, you can afford to lock in a small policy with a future increased rider, then it is advisable to set it up, And some tips are, in the future for disability insurance tips are: consider multiple policies, look for own occupation, ask about each of the policy features and option riders, and don't spend more on premiums than your cash permits. So this is the insurance tips that we're giving. Now thinking about retirement, why retirement is important and retirement financial planning. Make the rest of your life the best of your life, and retirement planning is important because we have to consider building tax-deferred saving buckets such as 401k, pre-tax IRA, tax-free saving buckets with Roth IRA, backdoor Roth IRA, and mega backdoor Roth IRA. Tax managed starting, a standard brokerage account with tax-efficient investment like index funds and etc. And all in all, the plan helps you make better career for your financial decision and finding solutions such as purchasing a home, children, grandchildren, changing jobs, divorce, caring for elderly members, growing children, moving back home. So these are all important. And I'm just going to go briefly because time is not permitting, but it's important that this is where it is important to work with an insurance broker and to help you maximize your benefits in the future while minimizing benefits while you also are in tight budget. So maximize the benefits. And while in school and residency budgets are tight, you have to think carefully about how much fixed cost you want to take on and how much benefits you need to protect. So let's say you get a minimum size policy, let's say for 2,500 per month benefit from, let's say, disability insurance. And then, life insurance is something that people have to consider because what you do matter, taking care of the elderly while you are working and meeting the leadership challenge in a long-term care. There are some positive aspects, and there is whole life insurance may be a good idea for you if you almost of the following are true. For example, you're living in a neighborhood with the highest tax bracket, you're in the highest tax bracket in retirement, you brought a pocket with good investment, you're committed to holding in your entire life, you will have no trouble making the premiums. With this money, this is the money you plan to completely spend in your retirement, and you cannot invest in an extremely tax efficient manner in a taxable account, and neither the government or any insurance company changes the rules of the policies over the next 60 to 70 years or 6 to 7 decades. So the basic idea is that insurance costs will be lower than the tax cost in the long run. That's why I recommend investing earlier in life for whole life insurance policy. And the withdrawal options for whole life insurance cash value in retirement is another opportunity, because we want to make sure that we have enough money for our retirement. And one of the biggest thing, the coolest thing about the whole life insurance is that partial surrender. For example, one of the coolest thing is if unlike annuities in which the first money pulled out of the policy is your gains, with the life insurance, the first money out is your basis, meaning it's tax-free and interest-free. For example, so if you had a whole life policy that cost $10,000 per year and paid up to 30 years, and it gains 4% a year on average, on the eve of your retirement, you may have a cash value of $583,000. So the first $300,000 of that you pull out will be 100% tax-free, because it's just your basis. So granted, after 30 years of inflation, the 300,000 you pull out won't worth anything near the 300,000 you put in, but it's better than a kick in your teeth. So you're saving. Remember that your partial surrender reduces the benefit, but it gives you opportunity to enjoy your life when you're alive. So it's very important. That's why I recommend. Now, just all in all, the having proper insurance planning by solution and improves outcomes, because today care models, insurance planning, or implementing artificial intelligence predictive models are helpful but insufficient. And it's important to have medical records are very important while you're getting insured, because underwriting, the better you are in health, the cheaper your rates will be. So quit smoking, tobacco chewing, and get in shape. Monitor your eating habits daily. The more you are in shape, the more you will enjoy healthy lifestyle. And insurance will deny coverage under a health insurance policy if illness or injury results of any intoxication and this or drugs or narcotics. So having a proper insurance planning will impact your lifestyle and will bring great results for you and your family. And the results are you are supporting, locating, and updating financial information for financial planning, bring transparency to your consumer lives through the insurance planning policy checkup, change to build changing relationship with your consumers, and all in all, you're having peace of mind. So why is this important for leadership and directors of the dental organization? This is important because 80% of employees say insurance and benefits give them peace of mind for unexpected. Without peace of mind, 3 out of 4 human resources professionals report that financial stress affects employees' performance. You have invested in hiring and training great employees. Does it make sense to protect that investment by having insurance in place? Yes, it does. So employees without disability insurance are less likely to return to work, which means devoting money, time, and the resources for replacement. So being firmly accountable, leading change successfully, and dealing with employees' emotions on this journey is critical for reinventing the business and coping with the external environment. Execution is vital from a competitive advantage when carried out than the competition. And again, financial professionals help you stay on track and achieve your financial goals so you can make the most of your life. And in conclusion, there are many reasons why financial planning and insurance planning is essential. Achieving your financial goals take a proactive approach. If you start planning for any need you have early, the better off your retirement will be in the future. And if you're nearing retirement, many strategies are available to help you make the most of your next 40 or 50 years or more in a retirement. We believe financial planning is an essential part of your financial wellness at our organization. Working together, we help you clarify your expenses, priorities, support short and long-term goals, such as build a prosperous retirement, as an ethical and unbiased leader, I will advise and advocate you, give you the recommendation that aligns with values. So I thank you very much for this opportunity. I would like to thank those who contributed their time and talent to help make this webinar successful for celebration. And if your action inspire others to dream more, learn more, do more, and become more, you are a leader. That's what President John Adams said. So if you want to learn more, and if these actions make you dream more, please make an appointment. I can explain more, and I will be happy to help. I express my gratitude. Thank you so much for the opportunity, and I'll be able to help to the best of my abilities. Thank you.
Well, thank you so much, Dr. Albana. That was a very, very informative presentation. And I think it's, you touched on so many important aspects that I'm guilty of doing many things wrong in my life and in my past. And, you know, life is a learning experience. And what I think is very important, many of us have different goals and different aspirations. And many of us define success differently when compared to others. But all these things that you mentioned and discussed are so helpful. And I highly, again, speaking from personal experience, I can't tell my younger colleagues how important it is to think about these things when you're young. Because you get older, watch it now, older, pretty quickly. And then you start looking back and you start saying, well, I should have done this, I should have done that, I should have done this differently. I'm guilty of so many things that I did wrong. So the young ones out there, my advice for you is take this advice that's sitting in front of you and think about it. And let's face it, all of us are, when we're young, we think we're invincible and we're never going to get older. And life sort of passes you. And you think I'll do this tomorrow, next year, and I'll start in 5 years, or once my practice starts reaching X amount of goal. And that's when we make the mistake. So listen to this young lady and take her advice for what it's worth and make your lives easier. So wonderful. Thank you so much, Dr. Albana. I'd like to open the podium for any questions if we have, Mr. Ansul. Ladies and gentlemen, thank you for joining us. Does anyone have any questions you'd like to ask Dr. Sgouridis? I guess nothing is coming in. So on that note, on behalf of myself and the Global Summit Organization, we thank you once again. We thank our audience for being with us. And don't forget, we love you.
Thank you.
Bye-bye.